Hey, thank you. Welcome, everybody. I am so excited to have this conversation with so many familiar faces, and we've got a lot to cover in just 40 minutes. So I'm going to jump right in and ask Dr. Yasmin. You have recently published a book entitled Viral BS, Medical Myths and Why We Fall for Them, which is quite timely given the fact that we are navigating both outbreaks of a virus and a lot of infodemics as well. Can you tell us about the process of writing this book and what you've learned from it?
Sure. So I actually started writing the book about 5 or 6 years ago, Jessica, not knowing it would come out during a viral pandemic and a misinfodemic. But at that time, I was a health and science reporter at the Dallas Morning News. And what happened was, in addition to my daily reporting, whether it was like feature stories or breaking news, I was just bombarded with reader questions about things that were related to health and science, but weren't necessarily in the news. People were wondering about certain vaccines, they were wondering about vitamin D, always wondering about vitamin D and omega-3 fatty acids, chemtrails, all these things. So I started basically a kind of misinformation column called Debunked. And what I would do is I'd take like the most urgent or most interesting questions I got and really kind of do a deep dive into where even did this myth about health and science originate. And then it really got into thinking about why do we believe the things that we believe. But one of the things that I learned was that so much of the questioning and the misinformation and disinformation around health and science had to do with way more than health and science. And it was frustrating to me that from our public health perspective, oftentimes we try and counter information with just more information, really with a focus on the science, when actually what I have seen happening over the last 6 years of tracking anti-vaccine movements and messaging with the misinformation and the disinformation out there, it's about so much more than what's inside the vial of vaccine. So for sure, there's always been the vaccines are toxic, vaccines cause autism. Those are not true, but those falsehoods persist. And yet what we also see is messaging that spreads online that says, vaccines are in opposition to the American way of life. If you get vaccinated, it means you are anti freedom, you are anti American. And I think it's really important for us to bear that in mind and realize that we can't just counter these falsehoods with science when that's an important part of it. But one, science literacy is really an issue or illiteracy. And then there are such deep cultural, religious, geographic, historical context to what the public believes about health and science. And I think we do people a disservice when we ignore those.
Yeah, it's true. I've noticed, that so many things, the conspiracies and the theories in general, are kind of copy paste from an anti-vax playbook, which brings me to my next question for Dr. Williams. As a practicing physician, you have had a wonderful background of scientific training, medical training, and you understand the value of consensus. But it seems like vaccine misinformation is especially targeting pregnant and lactating people right now. So as a physician seeing patients during a pandemic, can you tell us any themes or misconceptions, specific fears that you've identified with your patients?
Well, Jessica, this is a patient population that is vulnerable to begin with,
Yeah.
that is incredibly anxious to begin with, especially when you think about first time parents. I mean, for anyone who's ever been a parent before, that one bouncy seat that you had to have that was so important, or if you put your baby to sleep in this position, then baby will never, get better, never sleep well. This is a preyed upon group. And if we can get back to the why does that anxiety exist? Where are people getting their information? If we don't have something trusted to point to on one hand, and if we are not thinking about the why behind the anxiety, then we see patients really having a hard time. And we're in this pandemic. And in the pandemic, to begin with, we're in uncharted territory. So you take a population that is vulnerable, a group of people who are terrified of damaging their gestating fetus, and then feed them misinformation or disinformation on top of it. And I have entire visits that I'm spending just discussing the anxiety, and now discussing anxiety around vaccine. I think one of the places where patients have a hard time is that they are comparing having the vaccine in pregnancy or while lactating to doing nothing. And that's not the appropriate comparison. The appropriate comparison is to COVID in pregnancy, to COVID while lactating. And we know that COVID in pregnancy does have worse outcomes, does have increased rates of hospitalization, of being in the intensive care unit, of preeclampsia, of C-sections. So these various pregnancy outcomes that patients are trying to avoid are more likely to occur if they have COVID. So thinking about the individual patient risk and getting patients to think about the comparison group and then what's behind the anxiety, what is the fear, and then validating patients' fears and the unknown, especially because the vaccines weren't studied in pregnant and lactating people, really has been a more effective strategy than just bombarding them with more papers and the best written information that we can find.
Right, right. And so that actually brings up the topic of kind of being a trusted messenger, and medical mistrust, which we've noticed is an issue, a legitimate issue in many communities. So I want to present this question to the group. What can the medical community and even public health professionals do to ensure that the messengers of this information are trustworthy, particularly among communities of color with legitimate concerns in light of historical trauma?
I think there's a lesson perhaps to be learned from what's happening in journalism, where you see some outlets, Nat Geo, the Los Angeles Times, saying, hands up, we're going to start acknowledging and atoning for our racist past and our role in perpetuating white supremacy. And the reason that makes me think about medicine is because we have an equally or perhaps even more sordid history of exploiting vulnerable people and exploiting enslaved people, for example. And yet, I don't think we've ever had those conversations or that reckoning. Our medical school lecture theatres are still named after eugenicists and fascists, right? And yet, what we do in the middle of a crisis is say, trust us, here's a vaccine. Oh, why aren't you rolling up your sleeve? Oh, look, Black people, so vaccine hesitant. Like, that's become the conversation. And so I think we have to wash our dirty laundry very publicly. I think we need to understand and say why these communities don't trust us and talk about our role in that, and also not just framing it as a historical issue, because we have data about medical racism being very, very much a modern, current day problem. So I think that would play some small role, or perhaps a really important role, in building those bridges.
And every time I speak, coach my colleagues, that is where I begin. You do not deserve the trust.
Yeah.
Your white coat does not buy you trust from your patients. And so by acknowledging first, not just historical, but current day health disparities, racism in medicine, it's easy in the maternal health world because we know 3 to 4 times risk of death with Black women compared to their white counterparts exists. So we have to start with humility first and let patients know, look, this is going on. And you have no reason to trust me and to trust this scientific medical complex. But please, over time, I hope that I can earn your trust. That sort of perspective, I think patients really align with much more than the, well, what's wrong with you that you don't want this vaccine that can help save these communities that have been disproportionately impacted by COVID.
Right, right.
Yeah, I would like to add to that, because that's one of the specific issues with our Latino communities or communities of color, is that they have been deceived before. Yeah. And being that they have been deceived before, you know, right now, the trust not only has to be in collaboration, the trust has to be in really going to the local leaders, to the people who live in these communities and the people that they listen to, their doctors, and giving them information. One of the biggest issues right now that many people talk about is that they don't have information. They don't know where to look for it. And due to that, that's why we have these QAnon channels in Spanish that are, the disinformation is going high, and I can give some numbers later, but the fact is that there's a space now for information that these individuals, these people are looking for. Our communities are looking for it. So we have a lot of work to do in collaboration with the communities.
Yeah, this is actually, if it feeds right into the next question I had, which was for you, Evelyn. As a journalist, you've seen so many kind of clickbaity and panic-inducing headlines. What does trust mean on the journalistic side of communicating things about science and health?
Well, once again, trust means collaboration. And it's also been great to have journalists. It's great to have journalism, especially in the times that we live in right now, where many in our communities are told that the media are the enemy of the people, right? And that is something very big. That's the reason why I started looking more into this disinformation, because we were sounding the alarms of the disinformation we're seeing in these private WhatsApp channels. And it took for a journalist from Politico to write a story that brought journalists from all over the world to look at these private WhatsApp channels in Spanish. Right now, I spoke actually to the adjunct director of the fact-checking network for Pointer Institute, Cristina Tardaguila. And she was mentioning one of the things, once again, in collaboration, is that they have a coronavirus facts alliance database. It's the largest fact-checking collaboration project in history. It has 99 fact-checking organizations. It has 70 countries fact-checking in over 40 languages. And what they are saying is that they have found 12,000 falsehoods, this is borderless, in more than 60 countries in 43 languages. And what they're seeing is that 80% right now of the content in February was about vaccines. There are other things, but vaccines is what's coming up right now and is creating this distrust in the communities.
Yeah. Dr. Rasmussen, you've been debunking a lot of vaccine misinformation and a lot of just bad takes on virology, which is your expertise, on places like Twitter. I'm curious if you've observed kind of the why, the reasons why you think people believe and or spread misinformation.
No, I think that's a really great question. And it's also a really complicated one because there's not just one answer as to why. I think that a lot of people, as Evelyn was just saying, are getting information from unreliable sources. Now, whether that's a group in which misinformation is being distributed, whether that's just hearing from people that they know who might have an opinion one way or the other about vaccines in general. And some people are actively seeking out misinformation. They're very susceptible to the tactics that anti-vax groups used intentionally to distribute misinformation among people who are looking for information but might not know where to get good information. I think also there's certainly a general distrust of scientists and physicians and people who are part of the medical community, people who are part of the public health community. And in part, I think that's because of the way that the pandemic has gone. People have seen over and over again public health agencies making mistakes. I mean, in the US, certainly the Trump administration actively tried to undercut the CDC. And so it's completely understandable when you have somebody like Tony Fauci, who for decades has been a reliable, source of scientific information, is now this hugely polarizing figure. Things like masks and public health measures have become very polarized as well. And they're still polarizing topics. And I think a lot of people, based on their own personal beliefs, are kind of falling on one side of that to the other. Public health is the casualty that is sort of left behind. And public health is gained, trust in public health is gained in drops and lost in buckets. And it's just going to take a long time to get those drops back that we've lost.
Absolutely. Absolutely. I want to pose a question to the group. We've started to see that misinformation and disinformation has become even more targeted. Personally, and going after groups such as, pregnant and lactating people, racial groups, ethnic groups, religious groups, and even gender. So what are ways that we can support and empower these communities to fight back against these campaigns that are so deeply targeted against them?
I would say it's not a new phenomenon at all, Jessica. And in fact, when I've been teaching public health comms over the years, I say to people, let's take a page out of the anti-vaccine playbook, because one of the things they do really, really well that we don't do well in public health, and I don't think in the medical establishment either, is that hyper-localized targeted messaging. And in the book, I write about the horrific outbreak of measles that happened among the Somali community in the Minneapolis area. It was the worst measles outbreak in that state's history for like 3 decades or so. And these kids were hospitalized. It was horrible. And you can trace it back to about 10 years earlier when the Somali parents were concerned that there were perhaps higher rates of autism amongst their kids compared to white kids. And the public health department said, okay, we'll look into this. And in the meantime, literally Andrew Wakefield arrived in Minneapolis and other anti-vaccine groups holding these closed door town halls with armed guards outside them. So public health physicians and journalists can't get in. And what they did was really effective because they said, we heard you're concerned about higher rates of autism among Somali children. You're right, the rates are higher, and it's because you vaccinate so much with MMR. And then what we saw happen over the subsequent years was the vaccination coverage with MMR amongst Somali kids went from 92% to about 42%. And you think, okay, I mean, it was horrific, but it was also an example, sadly, of effective targeted messaging. And so I do get frustrated that in public health and in science, we often use a one size fits all message approach. And we say, oh, there are these myths about toxicity or about autism. It's just not true, when actually there is a science to science communication, and it really demonstrates that the answer to misinformation is not merely more information. And so I think, sadly, there are lessons to be learned about effective communications, especially hyper-localized, targeted messaging from anti-vaccine groups that have just been doing their job better than we have been doing ours. And it's been going on for decades.
Mm-hmm. We also have to think about who are the trusted messengers, because who we think, the groups that we think are worthy of trust is not necessarily the same group of people that our patients think are worthy of trust. So you can have the Society of Maternal Fetal Medicine put out a great statement, but who's really reading it? And what have these big organizations done to gain trust? So that's why exactly what she was referring to, such as the local folks, the local clinicians, the church leaders, the community group leaders, people in the school systems, that's who we have to engage to be our messengers, because really it's a lot of small conversations. I had a chat with folks when I took my boys to get their hair cut the other day with one of the barbers who's like, absolutely not, I am no way getting that vaccine. And maybe I didn't change his mind, maybe I did, but at least everyone in that entire barber shop, all 6 feet apart, did hear what I was saying. And perhaps these smaller conversations from people inside the community can start making a dent.
Yeah, I would say I would agree with that completely. I like to use, I work a lot in messaging, and just like the words they use that can create that fear, or, you know, in the QAnon groups, you see a lot of words. The words are, you know, charged. And for me, it's always, you know, they're probably targeting, but our work is to micro-engage. It's to micro-engage to a way that it's not only about culture, it's about the subcultures of those cultures. It's understanding how these communities live. And the only people who know that are the people who are actually coming from those communities. So, I mean, there's a lot of work to do. And it also has to do with the responsibility of having, let's say, the HHS, you know, give information in different languages that can then go to the communities. One of the things I've always said, and I think we all agree on this, we cannot wait for them to search for us. We need to find them. We need to go for them and look for them and give them the information they need.
Mm-hmm. Yeah.
And if I could just add to that too, I'd like to really echo everything everyone has just said about this. I think that the most important thing some of us can do right now is actually not talk, is listen. Because somebody who has questions about the vaccine development process, about the vaccine technology, those are appropriate questions for me to field. But if somebody has a completely different concern about the vaccine that I may not be an expert in, the most important thing I can do is listen to what those concerns are. And if I can't respond to them, have the humility, as Dr. Williams was saying, to direct them to somebody who they do trust, who can address those concerns. I think that there is a real one-size-fits-all problem, as Dr. Yasmin was saying, in which scientists really kind of respond to questions about vaccines with just hammering people over the head with safety and efficacy data, and how this is how the vaccine works, as if that's going to answer everybody's concerns. Many concerns have nothing to do with how vaccines work or the accelerated development pipeline that these vaccines for COVID have gone through. So I think that scientists really need to only address the questions that they are qualified to, and make sure that they are referring people to sources that would be reliable and trustworthy for other concerns.
Yes, that brings me again to, you guys are just feeding these questions in such perfect order. It's amazing. There is a science to science communication. There's strategy in knowing which myths to bust and which ways in which you can address concerns. So Dr. Yasmin, can you tell us about some best practices for scientists and science communicators when it comes to sharing information about very sensitive and delicate topics like vaccines and communities of color?
Yeah, definitely. And this is the thing I do worry about. In the book, I debunk, like, I don't know, some 40 something medical myths and health hoaxes, and there are some truths in there too. But the final chapter is, does debunking a myth help it spread? Because in the communications literature, there is a body of evidence that argues and demonstrates that when you even repeat a myth, just because you want to debunk it, you can be giving it more oxygen and giving it a platform and helping to amplify and accelerate its spread. So I do take that very seriously. And I think the reason I wrote the book, and because the reason I am passionate about still debunking and dissecting misinformation, is because there's also evidence that when it's done appropriately, when it's done well, it can be really, really effective in helping people understand why the information they're dealing with is actually false information. I think those best practices are really contextual and nuanced, and understanding what might be best left alone, what might even not be affecting a particular community that hard. That again comes down to engagement. And I really like the way of thinking about it as micro engagement, not making assumptions about particular communities, but collaborating with stakeholders and community leaders to be like, let me not throw assumptions into this conversation. Because I always say, you talk to 6 people who are vaccine hesitant, who are on the fence about different vaccines, you can get 6 really different responses as to why they've come to feel that way. So the first part has to be community engagement, understanding what really would be of service to the community, and then how do we address those issues. And then I start to worry less and less about just giving a myth more oxygen and more of a platform. But I think it has to be debunked in meaningful ways that make sense to the community. And again, I really believe with comms has to be a hyper-localized community engagement type of approach.
Right, right. Right. And so, Dr. Rasmussen, can you speak on what do you think the role of non-scientists and even science adjacent people have on the same question, on the influence? And I'm talking even people with verified accounts, people with large followings. When it comes to public discourse around these sensitive topics, what role can they play?
Well, I think one thing that non-scientists or science adjacent folks who, may be history experts or sociology experts or psychology experts, who can think about these things, even if they are not experts in necessarily the underlying science or medicine that's being debunked. I think it's really important for people to be very conscious of their platforms and how they relay information to people. We've had a big problem with the quote unquote armchair epidemiologists or sort of tourists in this space who have really kind of jumped onto the COVID communication bandwagon without really thinking very clearly about the consequences of, some of these really hyperbolic tweets, like, oh my God, the virus is mutating. Oh my God, the variants, the vaccines aren't going to work anymore, siren emojis and so forth. And the effect that has on people is it really doesn't inform them. It doesn't empower them with a better understanding of what's really going on, what the state of the art is in terms of the research and our understanding of this pathogen. it just scares the hell out of them. And then people, I think, are more susceptible to misinformation because they're looking for something that's going to validate their fears and their concerns and these really base emotions that they have. So I think that when people are communicating outside their quote unquote lane, they really do need to be very conscious of how they are sending that message out to people. Make sure they're sending out good information that an expert would look at and say, yeah, that's accurate, rather than, doing something basically to get lots of likes and clicks and follows.
Right. Right. I mean, that makes social media wonderful and terrible for that reason. I mean, it's become a critical social media and chat platforms have been a critical place for good information and bad information. And I know, Evelyn, you've kind of spent some time even infiltrating some of these spaces and kind of identifying some trends that are targeting the Latinx community. Can you tell us about some things that you've seen as trials and triumphs in that work? Sure.
Well, I'm really concerned. I'm concerned because of the level that this is heading within the community, in specifically in the Latino community. When you start seeing QAnon channels with over 5,000 subscribers that are country and culture specific, that focus, like you said, on everything from vaccination to political ideologies, from denigrating our current leaders to uplifting people like our former president, all in one day, continuous and repetitive, you have concerns because you realize that the $1 million question is, who's behind this? Yes, the anti-vaccine has been here for a long time, but there's also, it seems, something with a very strong intention to weaken the democratic institutions and our institutions here in the United States, no matter where the information is in other places in the world. And that concerns me. But I think specifically, I think that if there's something that I see from this is, once again, that we really need some serious research on specific communities, because it's very clear that they have researched us. And they have gone so specific to understand where to connect and building that trust within family and friends and people that they know. I started this seeing this information in 2018, but when I was invited to a COVID VIP leadership WhatsApp chat with 100 leaders in Florida, that started off with building the trust, and then 2 people in a COVID VIP leadership where they were giving information to our communities of where to get food because they didn't have food to eat. 2 people started infiltrating that group and putting anti-vaccination themes. And that is painful because it's abusing of our communities. It's manipulating them. And that's why I think all of us, it's a deep concern, no matter if we're in science or whatever industry we are, it is deeply concerning that we have to deeply look at this and find a way to reach these communities and make them realize what's really happening.
Yes. May I just really add to the back of that I totally agree with that. And as a researcher who's been trying to do that localized research in the 5 years, say, before the pandemic, it was so hard to get funding to do exactly that kind of research. And it was even hard, not even just to get funding, but to get buy-in from public health agencies who were really dismissive about the issues of misinformation and disinformation. And they would say things like, oh, but it's not a big issue. Oh, but vaccination coverage rates broadly are okay. And I wonder if perhaps, if it's even okay to say this, but some silver lining of the pandemic might be this realization that, oh, public health misinformation and disinformation really is a threat to national security, as many of us have been saying and trying to get support with for years.
Mm-hmm. Yeah. We've got time for one question. I think this will sum it up really well. And this is for you, Dr. Williams. We've talked about all of the many ways in which vaccine hesitancy is not just one thing. It's everything from distrust to dissent, indifference, and even deliberation and trying to make informed choices. So how can we avoid this issue, this complex issue, which predates COVID-19, from becoming a self-fulfilling prophecy?
Well, I think one of the first things we can do is be mindful of our language. and really think about deliberation, because people should deliberate. It is a good idea, especially communities where there isn't data, like breastfeeding and pregnant people, where it's very just limited cases, and also Black people, and specifically in America, where there are so many different examples, whether it's radiation experiments, syphilis experiments, involuntary sterilizations. We have to own and affirm people in their deliberation. And then have, as I said before, the humility to ask why, why they have concerns, and then see where are they getting their information, point them to reliable sources if that is what the issue is, and then just try to really understand how can we walk with them on this journey. This is not, as was said previously, a one-size-fits-all approach. The more strategic we can be about supporting our communities, the better off we're going to be in terms of getting our America vaccinated, so that we can get out of this pandemic once and for all.
Does anybody else have any thoughts on how we can prevent this self-fulfilling prophecy as we wrap up?
I'll quickly add then that I think this idea that there is science behind science communication, and there's decades of literature from communication scholars, which sadly too many of us in science haven't bothered to read, and it really does demonstrate the importance of narrative. And I got really frustrated with WHO a few years ago when there was a really bad measles outbreak in Romania, and they were like, but don't worry, WHO is disseminating pamphlets. And I was like, dude, it wasn't pamphlets that started this problem. It was these hyper-viral, really emotional YouTube videos of people saying and crying with their toddler in their arms saying, my kid got autism from a vaccine, right? You don't counter that with pamphlets with bullet points of facts. And I know we love our facts, but we really need to pay attention to the science of science communication using narrative methods, which are really have been demonstrated to be evidence-based ways of countering the misinformation, disinformation, building trust, and really just giving people the information they need in meaningful ways that can help them make informed decisions about their health.
I totally agree. And I would just end by saying that my challenge to myself, really through this whole pandemic and trying to improve my own ability to communicate with people, is really to listen more. We need to be meeting people where they are. Not everybody actually wants to hear about how an RNA virus replicates. Not everybody wants to hear about how an mRNA vaccine works. Some people want answers to different things. And then on top of that, we need to also have the humility to refer people to other experts outside of our field if that's where their questions lie. I've seen way too many people try to be an epidemiologist, a virologist, an infectious disease physician, a policymaker, all in one. And we all have our own areas of expertise. They're all important, but we also need to be humble enough to know when we're being asked something that's outside of that expertise, and somebody else might be able to answer the question or address those concerns in a better way. So I'm just going to conclude by saying that my own challenge to myself going forward, that I think will make me personally a better communicator, is just to listen and to check my own appraisal of my own performance.
Yes, absolutely. Evelyn, do you have any last thoughts on this?
No, I love the fact of just very true. Listen, listen, and it's important to realize that this is continuing, and we cannot just ignore it. We cannot laugh it off. Mm-hmm. This is going to affect a lot of things if we don't pay attention to it from the highest people in our nation to the local people. We really need to collaborate together to change the course for our communities to have trust in the vaccination system.
Yes, I completely agree. And I love that you mentioned even just the not laughing. Too much of debunking and demystifying can lean into sarcasm and name calling. And I think that there's a lot of empathy and space for that nuance that's required from all of us. I know that I have benefited from the kind of cultural competence and the empathy in which you all communicate about COVID and even on this panel. And I'm just really thankful for all of your time today. For those who are watching, I highly recommend following all of these wonderful leaders in this space who do their best to listen and to speak well.